Everyone, today I'm going to discuss about muscles of mastication. In muscles of mastication, we will be discussing about the introduction, that means their definition, classification, properties, muscles of mastication, primary muscles of mastication, their palpation, accessory muscles of mastication, clinical consideration, and conclusion. According to Merriam-Webster dictionary, muscle is a body tissue consisting of long cells that contract when stimulated and produce motion. According to B.D. Chaurasia, muscle is a contractile tissue which brings about movements. Muscles can be regarded as motors of the body. Mastication is a process which breaks up larger food particles into smaller pieces. It makes easier for food to be swallowed. Mastication is sensory activity aimed at primary preparation of food for swallowing. It is complex process involving activities of facial elevators and suprahyoid muscles and tongue. Development of the muscle. The muscular system develops from the mesoderm of first branchial arch. Muscles of mastication, tongue, maxillary artery, and trigeminal nerve are developed from the first pharyngeal arch. Second pharyngeal arch gives rise to hyoid, muscles of facial expression, stapedial artery, facial nerve. Third pharyngeal pouch gives rise to hyoid, internal carotid artery, and glossopharyngeal nerve. Fourth branchial arch gives rise to larynx, pharyngeal and laryngeal muscles, subclavian artery, and the nerve is vagus. Classification of muscles. Muscles are classified into various groups. Depending upon striations, these are differentiated into striated muscles, non-striated muscles. Depending upon control, these can be classified as voluntary muscles, which are under the control of the brain, directly control of the brain, and involuntary muscles, not in direct control. Depending upon function, skeletal muscles, smooth muscles, and cardiac muscle. Skeletal muscle. Skeletal muscle is attached to skeleton and forms somatic musculature. It is a striated muscle and is under voluntary control. Its main function is to maintain the body posture and position. Cardiac muscle. These are well developed cross striations and these muscles are involuntary. They maintain arterial blood pressure. The smooth muscles. These muscles are mostly present in the visceral organs. They lack striations and these are also known as plain muscles. And these are involuntary. Their main function is to maintain vegetative function of daily life like digestion, excretion, respiration. Muscles of mastication. Mainly these are four primary muscles of mastication, that is masseter, temporalis, lateral pterygoid and medial pterygoid. Later on we will discuss these muscles elaborately. There are some accessory muscles of mastication also along with these primary muscles. These can be divided into suprahyoid muscles and infrahyoid muscles based on the position above the hyoid and below the hyoid. Above the hyoid they are called suprahyoid, below the hyoid bone they are called infrahyoid. Functionally classified as jaw elevators and jaw depressors. Jaw elevators are masseter, temporalis, medial pterygoid, and jaw depressor are lateral pterygoid, anterior digastric, genioid, and mylohyoid. Now we will discuss about temporalis muscle. Temporalis muscle is a powerful fan-shaped chewing muscle which fills temporalis fossa. It originates from the infratemporal lines excluding zygomatic bone and temporal fascia. These insert into the margins and deep surface of coronary process of mandible and anterior of mandible. Their main blood supply is superficial artery and superficial temporal vein and middle temporal vein. Nerve supply is by deep temporal branches from anterior division of mandibular It is very powerful muscle. Side to side grinding movement can be provided by this muscle, and trauma can cause the fracture of coronoid process. So it is very important to palpate the temporalis muscle in case of sudden trauma or temporal bone injury. Now we will masseter muscle. Masseter muscle is the second most efficient masticatory muscle. The fibers are arranged superficially in mid and deep layer. Superficial fibers originates from thick aponeurosis from zygomatic process of maxilla and anterior two-thirds of lower border of zygomatic arch. These pass downward and backward at an angle of 45 degree and insert into the lower part of lateral surface of ramus of mandible. Middle layer fibers originates from anterior two-thirds of deep surface of and posterior one-third lower border of zygomatic arch, and they insert in the middle part of the ramus as we can see in the picture. And deep fibers originates from deep surface of zygomatic arch and insert into the upper part of ramus of and coronoid process. Functions to elevate the mandible, lateral movements of the mandible, grinding of food, and unilateral chewing can also be done by this muscle. Retraction of mandible. Its main blood supply is the branch of maxillary artery, and venous drainage is through masseteric vein. Nerve supply is from masseteric nerve which is a branch of mandibular nerve. This muscle can be palpated when we ask the patient to clench his teeth and use both the hands to palpate the muscle on both the sides extraorally, making sure the patient continues to clench during the procedure. Palpate the origin of the masseter bilaterally along the zygomatic arch and continue to palpate it down the body of mandible where the masseter is attached. The superficial and deep relations of this muscle are superficially skin, platysma, rhizorius, parotid gland and duct, zygomaticus major, temporal branch of facial nerve. Deep structures are temporalis and ramus of mandible. Now let's discuss about lateral pterygoid muscle. A thick conical muscle with definite upper and lower heads. Anterior margin disc and capsule of TMJ. Nerve supply for lateral pterygoid muscle is from the pterygoid branch of the trigeminal nerve, and blood supply is from the maxillary artery. Pterygoid branch from the maxillary artery and ascending palatine artery. It is the only muscle from the primary masticatory muscles which helps in opening of the mouth or depressing the mandible. Lateral and medial pterygoid, both the muscles helps in side to side contraction and protrusion of the mandible. When they contract alternatively, it produces a chewing movement. This muscle can be palpated with the help of forefinger or little finger placed over the buccal area of the maxillary third molar region and exerting a pressure in the posterior, superior and medial direction behind the maxillary tuberosity. Superficially, the muscle is related to masseter, ramus of mandible, tendon of temporalis, maxillary artery, and deep structures are mandibular nerve, deep head of medial pterygoid, middle meningeal artery, spinomandibular ligament. Muscle. It is a quadrilateral muscle having a small superficial head and a large deep head which forms the major part of the muscle. This muscle functions to elevate the mandible, closing of the jaw and side to side movement. How do we palpate this muscle is we gently palpate this on the medial aspect of the jaw simultaneously on both the side, inside and outside of the mouth. During improper inferior nerve block, the needle may prick and irritate the muscle, causing the spasm and consequently trismus. So we need to take care of this muscle while we are giving inferior nerve block to a patient. Superficially, this muscle is related to upper part of is related to lateral pterygoid plate, lingual nerve, inferior viewer nerve, lower part of muscle is separated from the ramus of the mandible, maxillary artery, sphenomandibular ligament. On deep relations are superior constrictor of pharynx, styloglossus, stylopharynge. Discuss about the clinical considerations. First is bruxism. It is the jaw clenching with or without forcible exclusive movements where the intensity of clenching dictates the severity of bruxism. Bruxism can be of three types: clenching, grinding, and tapping. Clenching, it can occur as a brief rhythmic, strong contraction of jaw muscles during eccentric lateral jaw movement or in maximum intercuspation. Grinding is because of the side-to-side movement, and tapping is because of the vertical movement of the jaw. It can be because of stress and can be because of non-stress reasons like hereditary reasons. It can lead to tooth wear, fracture of teeth, or restoration, uncosmetic muscle hypertrophy. Treatment can be coronoplasty, maxillary stabilization applied. A clinical consideration is tetanus. It is caused by gram-positive bacillus Clostridium tetani. It is a disease of nervous system characterized by intense activity of motor neuron and resulting in severe muscle spasm. It can symptoms like pain and stiffness of neck, muscle rigidity, trismus, dysphagia. Treatment may include antimicrobial drugs, active and passive immunization to tetanus, Clostridium tetani, surgical wound care, anticonvulsants can be given if needed. About the muscles of mastication. Thank you.